first dose of COVID-19 vaccines is not foolproof, experts say. Experts warn people to continue preventive measures against COVID-19 even after they got the first vaccine dose. This is because one dose is not enough to provide optimal protection. People who receive the first dose may be at a higher risk of infection compared to fully vaccinated individuals. The reason is the first dose is not foolproof, despite being effective. According to CBC, the first dose does greatly cut the risk of catching the virus, but is limited versus those who have not received at least one dose. There have been reports of a small number of people who still get infected and develop serious symptoms, with some being sent to intensive care units. Omar Khan, a biomedical engineering professor at the University of Toronto, said, "That means your immune system didn't have enough time to build up protective immunity to stop severe disease from appearing." When a person receives the first dose, it can take weeks before their body creates neutralizing antibodies against COVID-19. A month later, the immune system will develop more refined antibodies that can fight the coronavirus better. After a certain period, the immune system starts to remember and use this memory to fight the wild coronavirus with greater potency. To prove some insights, studies were conducted to determine how effective first doses are in combating COVID-19 and severe symptoms. A study published on April 22 in the New England Journal of Medicine showed that the efficacy of the first dose of the Pfizer vaccine was 68.5%, 1 week after being received. At 2 weeks, the efficacy improved to 92.6%, and researchers deemed Moderna's vaccine following the trend. Another study published in The Lancet on May 1 revealed that a single dose of AstraZeneca's vaccine could decrease COVID-related hospital admissions. The decline was 68% within a week and 88% a month later. Although the percentages may trick people into thinking to get just one dose, they may reconsider full vaccination in knowing the prevalence of variants. SARS-CoV-2 variants are believed to be more contagious than the original strain due to mutations, allowing the virus to easily infect human cells. Experts also think that the variants are very concerning. Current scientific reports hint at some variants dodging antibodies from vaccines. But why get a second dose if the first one can give high protection later? The second dose reinforces the protection from the first dose, giving the body a more robust immunity. So they strongly recommend combining vaccines with face masks, physical distancing, and regular hand washing to better avoid COVID-19.